Thank you, Honorable Chairperson. Honorable Chair.
Order, honorable members. Can we allow Honorable Singh to pose the question? Yes.
Thank you, Honorable Chair. Somebody who's been described as a certain leading academic, Franz Cronier, states, and I want to quote, that the National Health Insurance Scheme is nothing other than, quote again, essentially a form of expropriation without compensation for the private healthcare industry, close quote. Now, Honorable Chairperson, we as the IFP believe that all South Africans must have access to quality health care. That's a sine qua non in terms of what our Constitution enjoins us to do. What I'd like to know in terms of costs and containing costs, Honorable Deputy Minister, through you, Honorable Chair, what kind of synergistic relationship is envisaged between private healthcare practitioners and service providers and government to ensure that equitable access to healthcare takes place for all South Africans? Thank you.
Thanks, Honorable Chairperson. Again, I want to say that the principal differences here is that what is envisaged is to make sure that when you compare what we have now and what we are envisaging, let me just say an honorable member has broken a leg and needs an orthopedic surgeon to operate. At the current moment, you have to go to an orthopedic surgeon and then you'll be told it's going to cost so much, the hospital is going to cost so much, and so on. Now, what is envisaged is a situation where if you take the Cape Town Metro and you've got a number of wards and sections and whatever and so on, in a particular section, as an example, we will have an agreement with a group of orthopedic surgeons to say, you are going to service this particular area as an orthopedic surgeon. This is the population. Anybody with a broken leg here, we will pay you so much per month, and you are going to attend to anybody with a broken leg. So the individual member with a broken leg does not then have to negotiate price, because that specialist has got an agreement with the National Health Insurance to service the people of that area at a particular reimbursement per month or per 6 months or per year and whatever. So that also cuts out the issue of fee for service. So it's not a question that, I mean, when somebody comes, then so many bandages and whatever, but you are costed in terms of the population you are looking after and the average number of operations you're going to do per month, per 6 months, and you are reimbursed accordingly. So that's how you can then negotiate the fees. And the doctor is assured that he's going to get so many patients because they are already under the scheme. So just giving the members some example of what we're envisaging, how the system would work. Thanks, Honorable Chair.